All right, this is Dr. Sung, and welcome back to the Dr. Jin Sung Show. Today is Tuesday at 12:30, and the topic is diabetes. Before I get started, I'd like to thank all the people who have been sharing the videos, getting the word out, and changing the world. All right, so diabetes. So we're going to go into some basic things about diabetes, looking at some markers and blood testing. And then we're going to give you different types of scenarios regarding how diabetes affects your health, okay? So the number one thing with diabetes is blood sugar. So insulin resistance, where you're kind of before diabetes or pre-diabetes, your fasting blood sugar, so you haven't eaten between 10 and 12 hours, your blood sugar will be between 100 and 126, okay? So if you test more than once at about 100 to 126, you are considered insulin resistance. The diabetes marker is when you test for fasting blood sugar and it's above 126. So you test at least more than once for diabetes, for fasting blood sugar of over 126, okay? So if you look at the statistics, the population here in the United States, about 60% of the people are overweight. So 6 out of 10 people are overweight, and about 4 out of 10 people are considered obese. So the diabetes rate is pretty high here in the United States. So if you have fasting blood sugar above 126, you are considered diabetic. Also, another marker that you can look for is something called hemoglobin A1C, right? Hemoglobin A1C is a 3-month window of how your sugar looks in your body, right? So it gives you an average of 3 months of blood sugar. So if you're above 5.6 on hemoglobin A1C, you are looking at maybe insulin resistance. If you go above 6, then you are considered maybe diabetic at that point. So we're looking at blood sugar and how it's affecting our health system, right? So if you look at it, diabetes is the leading cause of end-stage renal disease or kidney disease, right? Your cardiovascular disease will go up between 2 and 4 times if you have diabetes. There's a significant increase in nerve damage, so peripheral neuropathy, retinopathy, meaning your eyes, can be damaged due to diabetes and poor circulation. Increased risk in cancer. According to the New England Journal of Medicine, liver cancer, pancreatic cancer, bowel cancer, and lung cancer can go up just because you have diabetes. So diabetes has a huge impact on overall health. So let's look at this. So if you have diabetes, the first medication that most patients go on is something called metformin. So metformin will decrease the blood sugar, right? But what it also does is it depletes B12. So if you're on metformin, I would highly recommend taking an additional B12 because it tends to deplete it. As a matter of fact, I think you should take a complex of Bs rather than just B12. Another marker that will go up with diabetes is cholesterol, and low-density lipoproteins, or LDLs, and triglycerides. I find that in my office, one of the leading causes of elevated cholesterol is blood sugar problems. So if you have a blood sugar issue, your cholesterol, LDL, and triglyceride will all rise. So it will be above the normal limits. So cholesterol should be somewhere around 200 to 220. Oftentimes you find people in the 260s and 270s, and that's usually due to mismanagement of their blood sugar. Okay? So how does this work? So your brain tells the pancreas to release insulin every time you have a glucose load, meaning you take in sugar. So the American diet is, inundated with refined sugars, high fructose corn syrup, all these sodas and so forth. So you have a high level of sugar. So when the sugar comes into our body, the brain signals the pancreas to release insulin. The insulin is what takes that sugar and pulls it into the cells to be utilized to make ATP. If you have high loads of sugar that come into your body all the time, you have a spike in insulin. This spike in insulin will cause the cells of your body to become insulin resistant, meaning there's so much insulin floating around that your body goes, it really doesn't matter. They become kind of numb to it, and they don't take the sugar into the cells. And the sugar will just float around in your blood system, damaging your vascular system. So it's important to manage blood sugar. So it spikes insulin, and when your insulin spikes, it also increases cortisol. Cortisol is a stress hormone, and elevated cortisol can occur with blood sugar, stress, lack of sleep, right? But what it does is it impacts the brain. It impacts the areas called the hippocampus, where the short-term memory lives. And it decreases short-term memory. And it affects brain function, brain fog, memory recall, and those types of things. So blood sugar doesn't only affect the vascular system, but it affects the brain, and it affects cortisol. Another thing insulin spikes will do is it will increase inflammation, right? So every time you have a glucose load, your insulin goes up, followed by cortisol, and then you're going to have a spike in inflammation. So prolonged inflammation will damage all tissues in your body, not just your vascular nerve tissue, but it can affect your kidneys, it can affect your liver, your gut lining, and so forth. So it's very important to look at the entire picture when you look at diabetes. So there are different forms of diabetes. So there's type 1 diabetes, which is basically an autoimmune disease. Most people find out that they have type 1 diabetes when they're much younger. This is an autoimmune disease, right? And most of those patients will either be on some sort of medication or on insulin, right? So that's an autoimmune process that's going on. Type 2 diabetes is when you have excess of sugar in your diet for a prolonged period of time. And then it creates insulin resistance, thereby leading to diabetes. So that's type 2. It's basically you're taking in foods that's causing you to have diabetes. So the first one is an autoimmune disease. Type 2 is a adult onset diabetes, meaning all the high sugars that you've taken in over your lifetime has finally brought you to that stage where you need medication. There's a little talked about form of diabetes called 1.5. This is adult onset autoimmune diabetes. What that means is there's something in your life, whether it be stress, hormones, parasites, heavy metals, whatever it is. It affects your immune system to attack your pancreas in your late stage of life. So it's a autoimmune trigger that causes onset of diabetes. So there's actually type 1, type 1.5, which is a late onset of autoimmune disease, and then type 2. Okay? So next week what we're going to do is talk about the different testing methods to really figure out what's going on with diabetes. And we're also going to talk about the management of diabetes, what kind of diet we should be on, what kind of supplements we should be on. Because many of the diabetic cases in our office are reversible to a certain extent. So if you're on insulin, you might be able to get to the point where you're on less insulin, right? If you're on just metformin, you might get to the point where you may get off metformin. It's all possible with a change in lifestyle and proper supplementation. And to figure all that out, we need proper testing. At the end of the day, we need to figure out what's going on and get to the underlying cause of as to why you have diabetes. All right. So we'll see you next week on the healthy side. It's going to be part 2 of diabetes next week. All right. Have a great day.